Hello my friends, and welcome back to my channel where we speak openly about HIV and AIDS. My name is Jendi. We are continuing on our series on vertical transmission, also known as mother-to-child transmission of HIV. In my previous videos, I spoke about mother-to-child transmission of HIV during childbirth and pregnancy. Today, I will be speaking about mother-to-child transmission of HIV during breastfeeding. The HIV virus is present in the breast milk and blood of an HIV-positive mother. Individual cases of mother-to-child transmission through breastfeeding were first documented in 1985. The level of risk is now more clearly understood, but much is still unknown about the risks and mechanisms of transmission through breastfeeding. It is such a difficult issue because breastfeeding is known to be the best way to feed babies, as it provides all the nourishment that babies need and helps protect them against infections. Research has shown that if HIV-positive mothers stop breastfeeding, more babies lose the benefits of breastfeeding and die from diseases of poverty such as malnutrition and diarrhea. Breastfeeding is believed to be more risky when 1. The mother has a high viral load. That is, if she became infected with HIV during the pregnancy or lactating period, or if she is already in the symptomatic stage from HIV-related diseases and in a late stage of the disease, also known as the AIDS stage. 2. The mother's nipples are cracked, or she has abscesses and other breast diseases. And 3. The baby has sores in the mouth or an inflamed gut. A study performed by the University of Natal, South Africa, produced very interesting but also very alarming results concerning breastfeeding. A group of HIV-positive mothers with HIV-negative babies were researched. The risk of transmission during breastfeeding were explained to all mothers. After this information, some mothers decided that they would breastfeed their babies because it would be culturally unacceptable or practically impossible for them to use artificial milk products. Other HIV-positive mothers decided not to breastfeed, but to make use of the artificial milk products provided to them free of charge. Some of the mothers who were using artificial milk sometimes experienced cultural pressure from their mother or mother-in-law to breastfeed the child. They would then switch between artificial milk products and breastfeeding. At the end of the study, it showed that the babies of the mothers who used mixed feeding were more likely to be HIV positive than the babies who received breast milk only. Research suggests that mixed feeding harms the lining of the baby's gut, creating entry points for the virus to enter the baby's body. Thus, it shows that there is a higher risk of a mother transmitting HIV to her baby when she practices mixed feeding, and mixed feeding is alternating between formula milk, solids, and breast milk, as opposed to exclusively breastfeeding their baby. In our Western culture, HIV-positive mothers are advised not to breastfeed their babies, but instead to make use of formula milk, solids to feed their babies. Please feel free to leave your comments or to ask questions. Thank you.